Okay. Looks like we are streaming live on Facebook, and we have about 38 folks who've signed on here. We have several more who have registered to attend. We do record the webinars and then send them back out to folks in case they weren't able to log on right away. And we also post them to our website. So if you're on the attendee list right now, or if you're catching us live on Facebook, you can follow up on our website to see these webinars as well. My name is Brittany Quickwarner. I'm the president and CEO at the Eugene Area Chamber of Commerce, and we are happy to have two wonderful speakers with us and all of these attendees. These webinars we started actually back in the spring, right around the time that COVID-19 really kind of started to permeate throughout our community, and a lot of businesses were having to make pretty radical shifts very quickly. And we were doing some pretty intense outreach to our members just to try and understand the issues that they were facing. And we're getting a lot of questions about things that we felt like we could probably provide some more information to a broad audience about. So we started these connected to community webinars. We took a little bit of a hiatus over the summer for a couple of months while our staff took some much needed vacation time, and we all tried to manage our mental health a little bit, which we're going to talk about today. And we are excited to be launching back into this webinar series. I'll talk a little bit at the end about some of the future webinars we have coming up. It would be remiss if I did not thank and mention the folks that you can see here to my side. These are our annual sponsors for the Chamber, and because of their investment, we were able to make these webinars free for our members and for the community. And so a huge thank you and shout out to those businesses who stepped up to support this work, even in a really incredibly difficult financial time. So we are forever grateful for that. I am going to let our speakers introduce themselves a little bit and talk about the work that they do and some of their initial perspectives on this topic. And then we're going to open it up for questions. So if you're on the webinar and you have a question, please feel free to put it in the chat here. And when we get to that point, we'll go ahead and open those up. We also have a list of initial questions that we can go ahead and get the conversation started with when that time is here. If you are following us on Facebook Live, feel free to leave a comment on the Facebook Live video, and we have a staff person who's monitoring that as well. So we'll go ahead and get those put into the Zoom so we can get those questions answered as well. So without further ado, I'm going to introduce Ryan Melton. Ryan's a professor at Bushnell University, and he's going to talk to us a little bit about what he does and his perspective on this topic.
Sure. Yeah, thank you, Brittany, for having us both. I'm really excited to be here, continue to talk about the topic of mental health in general. Obviously, being a professor of mental health, clinical mental health and psychology is something I certainly enjoy talking about, but it's certainly different to talk about it with students as we're teaching the skills as opposed to now applying it to the community, particularly in a time of significant mental health challenges where we're having this trifecta, so to speak, of challenges with COVID and fires and then racial tensions and how they all kind of somewhat overlap and are somewhat different. So excited to talk about that. Yeah, so I'm in addition to being a professor at Bushnell University, I'm also the dean of clinical mental health and psychology. Also do some research in the mental health topic, specifically around best practices. A lot of my interest is in research is around more severe mental health issues. So I have certainly that's where I carry a lot of my expertise, and some of that does cross over with what we're experiencing today. So that's me and a little bit of my background and initial thoughts.
Wonderful. Jess, do you want to introduce yourself and tell us a little bit about what it is you do?
Yeah, thank you. My name is Jess Richards. I am a fairly recent graduate of Bushnell University and a licensed professional counselor intern right now. I also run my own private practice, Jess Richards Counseling, where I tend to focus on people who experience like a high degree of self-criticism, have a hard time with self-acceptance and self-esteem. And my focus with that tends to be on self-compassion. So, looking at what's going on right now with just these these enormous multiple challenges that we're facing, my perspective and approach does tend to come from looking at it, as how can we be compassionate toward ourselves? How can we be kind toward ourselves? How can we take care of ourselves during this time? And what does that mean? And what does that look like? So that's how I tend to approach mental health in general, and especially what's going on right now.
That's wonderful. So, I kind of want to just get us started talking a little bit more generally about the topic of mental health. And, I think that we've all kind of noticed and hopefully appreciated the fact that mental health has become less taboo to talk about. And it's become a little bit more in the forefront of the conversations that we not only have with ourselves and our friends, but our coworkers and our employees. And so I want to touch today on a handful of things. One, just some general questions we have about mental health, counseling, and how folks should approach that. But then I want to talk a little bit about mental health in the workplace and how, as employers, we should approach this topic, how, as coworkers, it's appropriate to approach it. And then hopefully get your all's perspective on our mental health at home as well. And especially during this time, our home and work lives, I think, are even more intimately connected than maybe a lot of them has been for us in the past. So how do we manage that? How do we navigate that challenge? So I think just to get started in general, I just kind of want to hear a little bit more about sort of the evolution of mental health as an important topic that we should be thinking and talking about as a society, and how that plays in specifically during times of crisis, since that's kind of our focus right now with the year that we've had.
Yeah, it's going to be one of these moments, Jess, where we might Rochambeau to see.
Yeah. Say I can assign a start off point if you want.
Yeah, sure. Yeah, I can start on some of just kind of the broader topics of mental health. And Jess, she's has had amazing instruction at Bushnell. I'm not biased at all when it comes to that. You can certainly jump in. But you're right. I think I'm glad you mentioned that. But mental health, we seem to be, as a culture, more comfortable to talk about mental health. And I don't know all the reasons for that. I think some of it is that we've had more, whether it be celebrities or more, it's been more accepted kind of within the culture. There's more signage about it, more TV commercials, more things on social media around mental health and being much more accepting. Even the literature around acceptance of mental health and reduction of stigma is showing that's starting to pan out when we do surveys, with individuals on, how comfortable are you talking to your friends about mental health, for example. They're actually much more comfortable about it. And we're seeing this growth actually in younger generations. So individuals in high school and young adults seem to be much more willing to talk about it than maybe a slightly older generation. Actually just did a focus group with a bunch of adolescents in high school about what they would do if they noticed that one of their friends was having significant mental health challenges. And there was almost no responses on that. We would be afraid or to do. It was like we would want to help them, even with scary mental health challenges, like topics of suicide or even experiencing hearing voices or something significant like that. They're like, I'd want to help my friend, and I'd want them to talk about it. So we are seeing much of that, and that pleases me to no extent. I also think that as the medical profession has really kind of stepped up and embraced mental health as part of the work that they do. So we're seeing more mental health professionals collaborating with physicians in outpatient medical clinics, hiring mental health professionals to work alongside. And I think some of that comes from both the recognition of the need for mental health, reduction of stigma, and just a good percentage of individuals that seek medical care have a co-occurring mental health disorder, or they're seeking medical care for a mental health disorder that's disguising itself as a medical condition. Anxiety can present as chest pain, for example, and people may seek a physician for that. So I think that's again some of the reasons why mental health is kind of being more accepted and more on the forefront.
Yeah, I think we like you said, we hear people talking about it so much more, and just in my experience as a clinician so far, I think, yeah, some of those younger clients, those younger people are really responsible for helping to open up those conversations. And I wonder too, if, you know, if this is one of the positive sides of social media, is just people openly having these conversations and sharing, and starting to understand a little more about what mental health actually means. You know, that stigmatization and how we used to think that, you know, if you had a mental health challenge, or if you saw a counselor or whatever, you know, it meant all these things about you, or it meant you were, quote, crazy, or we tend to think of those extremes, you know, like people who do have schizophrenia or are diagnosed with schizophrenia, or, you know, a psychotic disorder. So just people opening up about their experiences and seeing like, hey, this is a really broad range here. Like, you don't have to be at that extreme to be able to, you know, get help, or to be having a problem that needs to actually be addressed. So I don't really know the reasons, but it's really cool that that's happening.
Yeah, so you kind of just brought this up, and this was going to be one of the questions. You know, if somebody out there is not familiar with counseling, or what kind of services are out there to support folks' mental health, they haven't necessarily felt like they needed that in the past, but for whatever, you know, reason, this year has maybe convinced them that they felt like they really should be talking to someone. How would someone go about just starting to really proactively address their mental health, both, you know, individually, but then also maybe seeking out counseling or some sort of professional support?
Mm-hmm. I'll start.
Yeah, go ahead, Jess.
Yeah. So I think and you're kind of pointing to this. The first thing is sort of like developing some awareness about that, right? And sort of doing like, I think doing like a self-evaluation and being like, okay, like what am I noticing? What's going on for me? Like, am I feeling anxious? Am I feeling depressed? Am I having a hard time getting out of bed? Am I, you know, and sort of, sort of looking at that. And that can be hard for people who don't necessarily know that those are mental health symptoms, right? But I think that if you notice that there's a problem, just going to someone, right? You can start with your medical doctor even, right? And they're gonna be able to notice that, or make an appropriate referral. And as far as looking for counseling, there are so many ways to do it. And I think that's what a lot of people don't know. People come to me all the time, like friends and stuff, and they're like, I don't know, how do I find a counselor? Like, I have to talk to my doctor. And I'm like, no, absolutely not. Like, we have Psychology Today, where you can get on and search, you know, counselors and other mental health professionals in your area, and you're going to get this huge, you know, range of profiles that you can look through. So you're actually getting to see what people are saying about their work, what insurance they accept, how much sessions are, and you get kind of a feel. There's a picture of them. Just searching, just doing a Google search, you're going to come up with counselors' websites. A lot of counselors have websites nowadays, as you know, they're sort of catching up with technology and realizing that that's a necessity. People are finding counselors through Facebook and social media. Of course, you can go to your doctor, you can call your insurance provider, and they can provide you with referrals. There's just such a huge wide range of ways to find a counselor. And even asking friends, right? Like, have you seen someone, or do you know someone who's seen someone? Do you have a recommendation? Those are just, you know, some of the ways to find a counselor, and to be able to kind of find someone that you might be able to learn something about before you go to them. Because I think, in my experience, that's what turns a lot of people off from seeking help, is they don't know who they're going to get. Mm-hmm. And there's lots of ways nowadays to kind of find out a little bit about that person before you go in, you know, and make that commitment for an appointment.
I'm throwing a couple of the things you put up in the chat just in case folks want to take it down. Psychology Today, is that a website? What is that? Yeah, it's a website. And it's a magazine too, so it's a little confusing, but if you go to the, Ryan's laughing. If you go to the website, psychologytoday.com, there'll be somewhere that will say, find a therapist or find a counselor in your area. Okay. And you just type in a zip code and it'll bring up a huge list of people. Great. So on that topic a little bit too, so say you're going down this path of trying to find somebody to talk to, what how do you start to evaluate who's a good fit before you actually, to be totally honest and transparent, I started seeing a counselor a couple years ago, and I had a lot of, I was very intimidated because there was a lot of things that I knew as soon as we sat down and we like got into these conversations, it would take a while before I knew, is this a good fit? And I don't want to keep doing that over and over again, right? It's an emotional, sometimes experience to have to go through that. So how would you suggest somebody, what should they look for? What kind of questions do they ask? What should they be thinking about before they actually sit down with someone for the first time?
Mm-hmm.
Sure. Yeah, I think we can go back and forth a little bit, but yeah, Jess, jump in.
Mm-hmm.
Yeah, I think a lot of counselors now do offer, at least those in private practice, for example, do offer a free or reduced price kind of meet and greets or sessions. They might have different terms for it. I think that's become a more of a standard of practice. And I think that's actually really important, as you brought up, Brittany. Part of mental health is that what we call kind of alliance or relationship. That it doesn't always matter, how skilled the counselor is. That it's really about fit. I could be an expert in one area, but may not be a good fit for you. Because you might have certain preferences or whatever. And so I do think that's, doing a little bit of search is not only wise, but I think that's going to make for better outcomes. When you find somebody that you're comfortable with. And one of the good news about counselors is there are a lot of counselors. A lot of them have a lot of specialties. So you do have some choice. Unfortunately, sometimes that's limited by insurance and pay structures and those type of things. But if you do have the opportunity to make that choice, I certainly would look for that and be comfortable doing that. So different levels. And so so it's okay to say, I'm actually much more comfortable with a male. I'm actually much more comfortable with a person of color. I'm much more comfortable with someone who's Christian or no faith. Those are all really important questions to ask yourself. So if that's kind of more the relationship piece, and if you have a specific challenge, let's say, post-traumatic stress disorder or you experience trauma, you may seek someone who's specializes in that. Both Psychology Today, Jody posted about better health. It looks like, so a ton of work that you could type in specialty areas, and those will also come up if you're looking for a specific, treatment for a specific concern. I would note that I would encourage mental health just for the sake of mental health.
Mm-hmm.
You don't always have to seek out a counselor when you're at your wit's end. In fact, sometimes we see people when we're like, oh man, we wish you would have came in 3 months ago.
Mm-hmm.
I think mental health care is self-care, is self-compassion, just to have somebody to talk to, even if it's just where they're a sounding board to you, can be incredibly helpful. And I would note that doesn't always have to be a professional either. That could be, that could be a friend, that could be a colleague, that could be someone from your church, that could be, I was just listening to a webinar the other day, someone found help talking to their barber, so I think talking and connecting is really important.
Yeah, I can relate to that. I think my group of friends, and I would admit as a millennial, I do think that this is something that we've just kind of grown up thinking it was not as taboo, but majority of them have a counselor, and it's not necessarily for any specific event or thing that happened, but it's more like I go to the gym for my physical health and I see a counselor for my mental health. Like it's just it just feels more normal right now, or in general, just like it's getting more normal, which I can appreciate.
Yeah, I think we don't tend to, it's great that people are starting to think of it that way, because mental health can be like preventative too, right? Like you work out, you eat well, you go to the doctor for checkups, like you can be seeing a counselor, before things come up. And I just wanted to add to what Ryan said real quick. I think this is just my experience. I've been to multiple counselors throughout my life during different periods. And I think that if someone, that 15 to 20 minutes on the phone, if someone isn't willing to give you that initial consultation, that would be kind of a red flag to me, because that's a really important time for you to ask questions and to see if this is someone that you really feel comfortable with. And like Ryan said, the treatment modality is sort of secondary to, do you feel comfortable with this person? Like, do you feel like you could trust them? What's your gut telling you? Do you feel like this is someone that you can sit down and talk with and feel comfortable? And I think sometimes we underestimate just how important that in and of itself is when picking a counselor or someone that we're going to confide in and seek help from.
So I want to talk just kind of generally about, the difficulty that I feel like this year has brought to a lot of folks. And, and something that not in my lifetime have I seen so many traumatic community or society or worldwide things impacting folks. I'm just curious, what are you guys reading about the impact that these disasters or crises have had on people, on society in general, just kind of a more like 30,000 foot level? What should we, as employers and in community members, what should we be expecting or thinking about through this time?
Wow. Okay. That's a huge question.
I was just going to say that's such a big question.
Yeah, it's a huge question. We can break it down, but really I think that there's just a lot of interest in like, how is this like impacting society in general? And I'm sure that there's folks who are hypothesizing about that right now. Obviously, we don't know for years to come, but.
Yeah. No, it's a huge impact. And I think for employers and for ourselves and for our family members, this is a huge impact. And it's a big question because I had an advisor that told me once there's a simple answer for every complex problem, and that simple answer is wrong. There isn't a simple answer to this. It's really going to be quite individualized in terms of how you're impacted. But the point is you are impacted. And some of the impact, depending on the situation, let's take the fires, for example. There's that initial shock. If you were evacuated or you lost your home or you lost some property or you lost a loved one, there's that initial shock and grief. So that's a different, and people are going to need support right then and there. And then there's that secondary impact. 6 months from now, when you have an insurance claim or you realize that something was lost. So it's not only, it's impacting us now, right, when it first starts, and it's going to impact us later. And we have to and I think that's where the preventative mental health comes in. Let's kind of keep talking about that. COVID has its own challenges. Certainly, it's caused both, fears. It's caused adjustments that we've had to do. It's caused loss of income, and so that again, the impact is and sometimes immediate, and then it's ongoing. So we have to kind of just be aware that even after the fires pass and the smoke is clear, the impact is gone. Even if our COVID numbers start to drop, the impact is going to be around potentially for years to come. And so just kind of being aware that, that there was going to be a ton of secondary impacts for all of this. We don't know what 2021 is going to bring, whether we're more in the clear or the impact is still there from the events of 2020. This just isn't going to go, even if the event slows down, the impact is going to remain. And I think that's what we're going to have to pay attention to.
Yeah, I kind of keep thinking about that too. And one of the things that I've been thinking about or have noticed is that, I think what's happening right now is putting so many of us into it's activating our sort of survival systems in a mass way that I don't know has ever happened before. And it's, it's event after event after event. So we start kind of adjusting a little bit maybe to COVID, and then there's the social justice stuff, and then there's the fire. So it's just, I feel like we're constantly sort of being put through this new, our survival system is being activated, and then it starts to calm down, and then it's being activated. And that's happening on this mass level, like you said, Brittany, that I don't think we've ever seen or experienced before. So and we all have like a different reaction to that, and different survival reactions, so I don't know like what the long-term impact is going to be, but I'm just noticing in the short term that a lot of us are experiencing those sort of symptoms of having our survival systems continuously activated and being activated for longer than they usually are.
Yeah. So how do folks how do they prepare themselves for future trauma, and what are some what are some techniques, some tangible things that folks could be thinking or doing right now if they're feeling stressed or overwhelmed by the scenario that we're all kind of finding ourselves in? What are some real tangible techniques that you give to patients or clients?
I'll let you handle that one, Jess, kind of given your expertise on self-compassion and everything. So yeah, go for it.
Yeah, absolutely. So self-compassion is actually just sort of full of tangible stuff that you can do. I'll just kind of I'll try to break this down quick. This is a big thing, but so self-compassion is kindness to ourselves, right? Which includes like soothing and caring, actively caring for ourselves. So asking, what do I need to be doing to care for myself right now? What do I need in this moment? And that soothing of our survival systems that I was talking about. So one of the big techniques in self-compassion is like meditation and breath work and stuff that gets us focused in our body and gets our breathing going, which tends to bring down that physiological activation that we get from survival situations. So finding some kind of different things work for different people. And I feel like it has to be really individualized. So finding something that you can do that involves breathing or getting grounded in your body or that's meditative, anything that you can do sort of in that realm. The other thing is really actively coming up with ways to soothe our fears, right? And reassure ourselves. So this isn't like affirmations where we're saying things that aren't true or we're trying to like pump ourselves up. This is like actual soothing, like you would soothe a child, right? Or you would soothe like an animal or that's distressed, right? It's like, you're okay, you're safe right now. Like, I'm going to be here to take care of you. Like, we're going to find a way to get through this. And that's going to be different for everyone too, but actively coming up with ways to reassure yourself and to sort of provide that, that love and that safety for yourself is really, 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 really important.
Yeah, that's great.
Mm-hmm.
So I want to shift a little bit to the conversation about just mental health in the workplace and as coworkers and employees, how we can kind of navigate this issue together. First, just how would you recommend folks facilitate a conversation about mental health in the workplace in a way that's appropriate, but also, you know, really helpful to the people who are working there? So let's say from the perspective of an employer to start with. As an employer, how can I be doing a better job of supporting and having a conversation about mental health with my staff?
Yeah, I mean, I'll throw out some ideas and then have Jess jump in. I mean, I think it starts with sometimes even your mission statements and your policies and procedures or whatever that looks like in your business. Is there a statement about mental health? Mm-hmm. You know, there's oftentimes statement about your state rules or, you know, FEMLA or, you know, some of those leagues that are offered, but is there a statement about mental health? Is there a culture within the business that supports, you know, mental health care, whatever that looks like, or self-care or self-compassion, you know, that can also be part of it. Is there a place do you have an EAP, you know, as part of it? If you don't have an EAP, do you have a list of groups? I think I see Caleb, you know, put in the chat a list of potential resources. Is that available? Is that part of your policies and procedures? What are those resources available to talk about mental health? And just have that there, just so that you send a message to everybody that, yeah, we recognize mental health as a challenge, as a real thing that impacts all of us at different levels. Sometimes at severe levels, sometimes more as a preventative. I just got to take care of myself today, and so that's just all part of the culture, you know, within the work. And then maybe there's some specific you know, when we think about self-care or self-compassion, those are all broken up into different segments. There's self-care at work, you know, maybe there are those tips, you know, what are the specific examples in your place of business where you can take care of yourself, whether that's asking for help, you know, or maybe that's, you know, additional break, maybe that's working from home, you know. Obviously there's a ton of businesses that have different rules, but what can you apply to your specific business that really fits that idea of self-care, self-compassion at the workplace and make it really specific to that. Again, and I think that just honors the fact that mental health is important within that business, so it doesn't become something that's stigmatized. Because I honestly believe if we're not talking about it, if the leaders aren't talking about it, then those that work under us aren't going to talk about it, or might unintentionally send the message that it's not okay to talk about. Yeah. Generally, we don't have a problem in the workforce if I've got a sore tooth, me going up to Jess and say, hey, do you have a good dentist? And Jess would have no problem making a recommendation. And that's completely accepted. And we need to get that with mental health too, where I'm saying I'm really impacted by, whether it be a fear of loss of my job because of the realities of the financial impact of COVID, or secondarily, I'm worried about my family because that impacts us. And, and then having the workforce be able to say, here's what we can do, and being prepared to do that. So those are just some thoughts, I guess.
Yeah, that's great.
Yeah.
Jess, anything you want to add there?
No, I'm not much. I agree completely. I think that you have to find some way to let people know that mental health is something that's valued and that it's okay to talk about it. Like Ryan said, it's okay to come up and say, hey, I'm not feeling well, I've got a stomach ache or, whatever, can I go home? But I mean, talking about mental health isn't going to be comfortable if there hasn't been like a foundation laid that the employer actually cares and values mental health, and that it's something that's okay to talk about and it's understood, and there's sort of that safety that it's not going to be stigmatized, right? And yeah, I think like Ryan said too, just offering tangible resources too, like EAP, and letting people know maybe how do you find a counselor, right? Maybe like sending that information out to people, so you're not only letting them know that it's important, but you're sort of creating that bridge for people to actually be able to take the action too a little easier.
Yeah, for us, for me at least, super important that folks know like our sick leave policy covers mental health as well. I think that seems like a pretty common thing now, and employers have really adopted that. But in case it doesn't, like making sure that your staff know, like maybe a sick day for you is actually you need to step back because you're super overwhelmed or stressed or you're feeling really emotional, like that those are all appropriate reasons to take a sick day too. So I would add that to the list. I think that's a tangible way that employers can make sure that their folks know that that's important to them.
Absolutely. Oh, I had one more thing I was thinking too, which was, oh, what was it? I lost it. You like prompted it and then I totally lost it.
That's all right.
Okay, never mind.
Yeah, Brittany, I think that's a really nice point, that sometimes we make assumptions of people that they're going to know something, but I think being deliberate about that yes, just for, sick time also covers your mental health time. And, so yeah, I think that's awesome.
Possible, as an employer, when you're looking at different healthcare benefits, if that is something you're able to offer your staff, to look at it and see if your insurance provides or covers mental health services as well. So
right, it's because some don't. I mean, we do recognize that in some cases there are sometimes insurance barriers, and then if that is the case, then what is the employer then doing about it? Yeah, our specific policy doesn't cover it as much as we would like, but here are those other resources. Here's the number for Bushnell University's counseling. Here's these other resources. So that's certainly to have that there.
I remember. Okay. So I'm a huge fan of asking people like what they want and need and what would be helpful for them. And you may not be able, an employer might not be able to do all of that, but I think, just starting with employees and asking like, what would help your mental health while you're at work? What can we do that would assist you, with your mental health at home, if anything? And just sort of like maybe a survey or like I don't know how people would be most comfortable with that, but not assuming too what people want and need and what would be helpful, but actually asking them and seeing what you can implement.
Yeah, that's really good. So you may or may not be able to answer this, but I have talked to several employers who are dealing with this issue specifically. So, a lot of us have been forced to, work from home, right? We work in an office environment. our staff are able to, physically we're capable, we have the technology to work from home. And so the state is encouraging that we do that. But it's really hard to observe people's, mental health stability when we're just interacting with them over Zoom a couple times a day, if at all. And I think a lot of times it sort of comes across as someone is underperforming or they're not enthusiastic about their job.
Yeah.
Maybe they are underperforming because of some of the stress. How, as an employer, do we navigate someone who's underperforming, but like understanding that this year has been this like anomaly as far as stress and mental, just like people's mental capacity to deal with what's going on? I think that there's a lot of employers out there who are like, gosh, I don't want to assume that someone just isn't doing their job well if there's something else going on.
I think like it probably depends on your comfort level as an employee or as an employer, but I'm an advocate of just, sort of compassionately reflecting what you're seeing. So here's what I'm seeing, and asking, just asking, like, I'm noticing that this is going on. Like, I'm wondering, are you struggling? Or I'm wondering if there's something, just sort of an open-ended question, and then seeing, what answer you get and going from there. But I don't think there's anything wrong with just asking directly in a kind and professional, with all those boundaries and stuff. Yeah, just saying what you're saying and asking, and then seeing what you can do, if anything.
Yeah, I'd add a little bit to that. And one, as an employer, and I know all jobs are different. I'm not an expert on every employer who's on this call and anything like that, but I would also ask you to trust yourself. You hired this person. You hired them with the intention that you were assuming they were going to do a good job, and you had evidence that they were going to do a good job. That's why you chose them. Mm-hmm. And now we're faced with this kind of large, again, trifecta of challenges, and you see their performance all of a sudden start to slip. Then I would completely agree with what Jess is saying. Let's go back to what our shared values are. Mm-hmm. Our values are the interest of this agency, this company, this university, and we know that. So we're wondering what could be going on? How could we support you? Is something going on with your family, with yourself? Mm-hmm. And don't underestimate the impact that families are having on this. And I know that I've had to take time to care for family members who were struggling because of these very specific situations. So I think, I would agree from both a values and standpoint, as well as just respectfully asking, what's going on, because I think most people, and maybe I'm an optimist, but I generally believe most people do the best they can when they have the resources to do so. And what these events that are happening right now, they're taking some of our resources mm-hmm. that we normally have had.
Yeah. And there might be a solution too. I think when we don't ask, we don't really open that door to find a solution together, because maybe there's something they haven't thought of that would help, or maybe there's something opening that conversation allows for a much, much, much better possibility of actually coming to, finding a solution and correcting, or at least maybe partially correcting the problem.
Yeah. So to flip that on the other end, if I'm an employee and I'm struggling, with my mental health, whether it's an overload of work, whether it's dealing with some of the trauma at home, whatever it is, how would you coach your client to approach their employer to really help them understand that this is something that I'm dealing with?
Mm-hmm.
Jessica, your office, I ask you that. So you're seeing clients right now. I'm not.
Yeah.
But I have some thoughts on it, but I'd love to hear what you're thinking.
Sure. Yeah. So, obviously it's going to be different for everyone. So I'm just going to provide sort of like a general framework. I would really just get the person kind of, it's, it's scary. So talking first, like, are there concerns there that they have? Often there's a fear of what's going to happen, right? So kind of really identifying what are the fears here. Are they, what's the right word? Not are they rational, but like, is this a is this something that might actually happen, or is this sort of a little bit of a cognitive distortion, right? Like maybe we're not thinking about this clearly. And really sort of preparing for, okay, what if I do get this? This is just how I do counseling, you know, preparing for what will I do if I do get this response, and really helping people practice sort of talking about it and addressing the responses they might get. And everyone's going to have a different level of comfort with how much they're willing to share and how much they're comfortable sharing with an employer. But just really identifying, like, what are the concerns? Can we address those? Can we be prepared for those? And practicing having that conversation.
Yeah, I would just add from just a resource standpoint, when I used to do family work, and some of my work involved when a family member would become quite impacted by a major mental illness. And we strongly believe that having more people involved is better as long as they're supportive. Mm-hmm. And so we would say, who in your family is supportive? Who would be most accepting of the challenges that you're having? I mean, I fully recognize mental health accepting, but I also recognize there is still pockets of our culture and society that don't accept mental health. And I'm saying this because I'm reading Malaya's comment, that maybe that the workplace isn't as safe as we would like it to be. So where would you start? What are you comfortable with disclosing? Is it your boss? Is it a coworker? Is it HR? Just what those policies are. So I think having that conversation on what is the safest route, what has come up before, what is the culture of your workplace. For some, it's great. I can talk to my boss about it. I just need some coaching. Others, it's like, oh, I don't know if my supervisor or this is supported in the culture. I'm like, well, let's take a look at your HR policy. Let's see what's the specific language is about mental health, if it even is there.
Mm-hmm.
I think there can be different approaches in that way.
Yeah, that's wonderful. Thank you. So what about if you are witnessing or seeing somebody else who you feel like might be struggling, but you're not really sure? Like, what are some of the signs that we as coworkers or as family members or friends can be watching for from someone who isn't disclosing on their own that they're having issues? And do you have some tips that you would give someone on how to approach that person, what you might say to them, to try and make sure they know someone's there for them? I know that there's research out there that's already indicating that there is an increased amount of suicides coming out of this year. And obviously, we all care deeply about our youth and the amount of suicide that's growing in, younger population. So how can we be better advocates for our family and friends, coworkers, so we can recognize when there might be something that we could do in advance?
Mm-hmm.
Yeah, I know you're right on the suicide count. I just read this morning a 23% increase in suicide in 2020 as of right now. So yeah, we're being impacted. That's what I'm saying. We're certainly being impacted. So it's almost even a fair assumption, that one of these three major impacts that we're having are things that are happening in our culture are going to cause difficulties. So I think the main thing to look for, and it certainly varies from condition to condition, but the main thing to look for almost across conditions, when we're thinking about depression, anxiety, suicidality, impacts of trauma, is uncharacteristic change.
Yeah.
That this person, that's not how my friend, that's not how my colleague, that's not how my family member normally acts. And I don't actually have a good explanation to why, at least that's out there. It's like we all have our coworkers that come in that are more frustrated. I just had a bad day, or I just had a fight, or I just had to pay, my car got hit. Okay, that's explainable. Yeah. It's that uncharacteristic change that we don't see an immediate kind of explanation for. And we need to ask. And I think Jess's point earlier about just being transparent and genuine. I'm wondering, how are you doing? I mean, really, how are you doing with all this? Not just a general, how are you doing? We kind of give that canned answer, fine. How are you doing with the impact of the COVID stuff? How are you doing with racial? I mean, particularly our colleagues of color. Mm-hmm. How are you doing? I mean, and kind of showing that you are an ally in that.
Yeah, I don't think that was going to be my answer too. Yeah, nothing to add to that. Any kind of, change.
Yeah. I mean, again, for transparency, and I feel like it's important to normalize it. I was diagnosed with depression a couple of years ago, and for me, it was, I just sort of had this mental toughness, and I thought I was just having a lot of stuff happen in my life, and I was going to get through it, and I was fine, and like this is situational and temporary. But it was actually a trigger of folks who were kind of like, you usually are incredibly optimistic, and now you've been pretty pessimistic about a lot of things consistently. And that was the trigger where it was like, okay, this is actually something that is bigger than just this one thing that I have to get through. And so I appreciate that. I think it's finding things that, people that well, like, okay, this is going on for longer than just a bad day or a bad week. And for me, that was super important to have a couple folks point that out to me, because I think that in my head, I just kind of wrote it off as like something that was happening right now, but it wasn't like a long-term, impact on my life. So I think that's really important advice to kind of pay attention to your friends or your coworkers to see some of those more obvious shifts that they've had.
And Brittany, I'm curious, because I think this is a fear that people have sometimes about approaching their friends or coworkers or family members. How did you receive that? Like, was that difficult to hear that from someone, or was it like, wow, okay, yeah, thank you?
To be honest, it was both in some cases. I think that honestly, it was a relief, because I'd felt something was off, but I just sort of was like, okay, it's just in my head. Like, this isn't really, you just kind of talk yourself out of it, right? You're like, this isn't me. Like, I don't know. I don't have issues like this. But when someone else says to you, like, hey, this thing is something I've been noticing, it almost is a relief to you, because you feel like, okay, I'm not just like imagining this. Like, this is something that is actually, that's coming out in my life as well. So that it was mostly a relief, but there's a little bit of it that you just don't want to believe it, right? You don't want to think like that this is impacting me. But I will say that, once I like came to sort of, came to terms with it, there's so many people in my life who have gone through this too. And they're like, oh yeah, for sure. Like, I've been on antidepressants before, I take anxiety medicine, or I see a counselor regularly. And it's like, once you just start talking about it, it's so much easier to cope with. And so for me, that was important. I wasn't planning to share all this, but I also think it's important that if you're comfortable to share it, because it does help normalize it for some folks.
Absolutely.
But yeah, I think not being afraid to say to somebody, and I like asking a specific question, not just how are you doing, but how are you doing with X, Y, and Z? Because it does sort of like prompt us to actually like dig a little deeper about how we're feeling about things.
Yeah.
So I'm curious about kind of taking this advice home, and a lot of folks who are now integrating their work in their life a lot more. How do folks can improve their conditions at home to have a more peaceful, productive environment, so they can try to manage their mental health and their work life a little bit better?
Ryan, I'm going to let you take this, because I don't have the challenges that a lot of people have at home. So.
Sure. And so I think you're right. I mean, working from home, I think sometimes I think was this natural something that's going to be easier, and maybe for some it is. I mean, I can speak personally. There's challenges with it. There's space challenges, particularly with, again, multiple things are happening. It wasn't just, for me personally, it wasn't just work from home because of COVID. Oh, I'm also going to work from home. I'll be working from home because of COVID, but I also have my 2 young children who aren't in school right now, that are there. And then for their own safety, person may not be able to leave the house that often. So I do think it is important to kind of create, if you need to work, to have that workspace, to try to get that, and some people are fortunate to have a home office, others don't, so you're working from your couch, kind of setting that rule, setting that space up for you, but then also just giving you that time. I know I have to tell, my daughter that I will read that book. I have to give me this time. And once Dad is done with this, then I read the book. There's all those kind of things. So I think being deliberate, being transparent, setting up, still treating it like a workspace. And in that's just kind of just one example. Also recognize that people are giving incredible grace right now. And so again, when my 4-year-old crawls over the top of me, I'm initially feel embarrassed, but everybody in the line said, "Oh, that's so cute." And I was like, "Oh, I just won points with everybody here. I don't know if they even are interested in what I'm talking about anymore." you know, but I think one, it's recognized people are giving grace. You're probably giving grace to your coworkers. They're probably giving grace to you because of the situation, because we're all in this together, although we have different experiences. We have a similar global experience. How we're able to handle it certainly is different. I absolutely acknowledge that, but we're all experiencing the same things. How we're able to deal with it certainly is different. So you have to figure that out for yourself in some ways, but recognizing that people will likely give you that grace. Take your breaks. I found myself that because I can be on Zoom all day, I will schedule back to back to back to back appointments. So still working in those breaks. And for me, it's just kind of standing up and walking around, or stretching, or again, whatever that is for you. I mean, the idea of self-care or self-compassion, the first word in that is self. So it's whatever works for you, always exercise. For me, it's going for a walk. For others, it might just be vegging and watching something on YouTube for 20 minutes. Whatever works for you is what I would certainly recommend.
Yeah, I completely agree. I think like the first question is like, what do I need? What do I need and what can I do? Like, how much of this can I do? Can I set, timelines? Can I create spaces? Whatever you can do to help yourself, by all means, do it. And then whatever's left over after that you don't have control over, I think is where that self-compassion or the grace that Ryan's talking about comes in huge. It's like, can we just not judge that? Let that go, don't let that judgmental voice come in, or that critical voice trying to, nitpick and stuff. Like, hey, it's okay. And part of self-compassion, and Ryan mentioned this, is common humanity, recognizing common humanity. And we have no bigger situation right now that sort of points to common humanity. We're all in the same boat. Like, we're all struggling with the same stuff, and circumstances are different, but this is a universal experience. So really just letting some of that judgment go, and being kind with the stuff that you can't necessarily do anything about.
Yeah, I like that. I think that, oftentimes we tell ourselves in our head that someone else is judging us more harshly than we would be judging them. And so giving them that same sort of, that they aren't judging you. Are you judging them for that? No, then don't assume they're judging you for it either. I think that I have to constantly remind myself of that.
Absolutely.
So I'm curious, I had a question, and please, if you are one of the attendees still on and you have questions that you want to ask, please, again, feel free to type those in the webinar chat. We have a couple more minutes left for those. A question that another one of our staff brought up was, how can some of these tips and tricks or advice translate to our kids? A lot of us are dealing with, how to manage our kids' mental health through this as well, because they're experiencing trauma alongside the rest of us. So any advice you would have for that?
Ryan, I'll let you take that one too.
My disclosure on having children led you to in some ways it's similar. I mean, for uncharacteristic changes in them, and recognizing that some of our natural coping skills to work with our children aren't possible right now. For example, if I was working at home with COVID, I could send my children out to play or do something like that. Well, not when the smoke quality is so terrible that that's not a safe thing to do. So similar to what Jess says, is it kind of, in some ways, kind of compartmentalizing what be planful in some ways is that you can. And I fully recognize that's not always easy. Intention is like, I'm going to get up at this time. I'm going to make sure these books are ready and laid out for them. Then I'm going to be on this meeting for an hour. Yeah, I give myself grace on that as well. That all best laid intentions don't always work out, but if I can get 60-70% of it, I'll take that. Especially kind of everything else that's going on. But yeah, so I think there's a lot of that. But our children, there's so much going on with them that it's. I've got children in different developmental age groups. For my younger child, it's like she has so much energy, and being confined is very hard for her. And so even just having her run around the house is incredibly helpful, and either muting as she runs by me or letting my coworkers know, yeah, she's getting out her wiggles right now. And then my older daughter, who's middle school age and just is not connecting with her friends in the same way that she would normally, and what a tremendous disappointment it was for her to not be able to go to school. What a loss that is for her. Mm-hmm. be in school. So how does she continue to connect? How does she prepare for when this does happen? You know, I mean, historically we said, hey, limit kids' social media time. You know, now maybe it's limit unhealthy social media time, increase healthy social media time, which might be connecting with people, you know, connecting with your friends, given that that's just a very healthy developmental task at that particular age, you know. So being able to continue to connect, allowing them to connect virtually, doing the items with others that they can't connect. Sometimes my family will do the virtual dinners. You know, we do that with the grandparents, you know, those type of things. Do that with friends. You know, I've created my own mental health by being able to connect with friends that I haven't been able to connect with. By every couple of weeks, we're doing a Zoom call with each other just to hang out, you know, and and I think our children need that connection as well. We're generally social beings, and others, and this has made it incredibly challenging at multiple levels.
So we have a couple minutes left, and I have kind of one final question, if it's even possible to kind of give this advice. So I think that, you know, at least for me, when this, crisis started back in March, April, in my head, it was a couple months. We just have to get through this. It's just a couple months. And then as the summer's gone on and, you know, cases have increased and, you know, it's becoming more obvious that it is not just a couple months. And we're looking at, you know, well into 2021 that we're going to be living in sort of a similar environment. How would you coach people to prepare for this now differently than maybe what we thought several months ago? Like, is there any tips or tricks that you would put out there just to help people cope, knowing that this is going to be another, you know, 6 to 8 to 12 months that we're dealing with this?
So I'm just a big fan of approaching things sort of on two levels, like the practical planning level, and then the emotional, mental, you know, the mental health level. So just sitting down on the practical side and being like, okay, you know, I sort of accepting the reality of it, right? This is how it's going to be. There's nothing I can do about it. It's going to be okay. And what do I need to do practically to plan or prepare or organize for this, if there is things that you can do, right? I think it's really important to go ahead and take care of that. And then on the mental health side of it, I think, again, we're just looking at that, like that self-compassion and that acceptance and sort of just being in the moment and taking it, oddly enough, being in the moment, right? Instead of like, oh, I wish this was over. Oh, it isn't going to be over, right? Be in the moment, one step at a time, right? And like really, really reassuring ourselves, really like soothing ourselves, really being there for ourselves as we take this step by step by step, and doing the planning, but not letting it get like super future oriented, right? And kind of spinning out on that, but like, what do I need to do just in this moment? I've got my plan, but now I'm in the moment, and can I accept this and not judge how this is all going, and just let it be and let it be okay, which is easier said than done, I know.
Well, things are easier said than done, but yeah, no, I agree with that. Because we can't exactly predict. We're not going to be able to clearly predict the duration or the impact, and probably the latter is what we're going to have a harder time predicting. So I think Jess is right. Being as prepared as you can be, giving yourself kind of forgiveness and grace and self-compassion on what you don't get done. I always kind of have a little bit of the 60% rule. If I get 60%, that's pretty good, given that I didn't know what I didn't know. So if there are things that you can do, short-term planning, what do we have to do this month? What do we do the next 6 months? But I think Jess is right. If you start getting out to, well, this is going to last for years for you, we don't know. And I think we can work ourselves up, and we can start to even cause our own anxiety. So I think short-term planning, some long-term planning, but don't become overly predictive unless it's like a long-term stuff that you know. So take I'm also a fan of the easiest apple to the ground. Let's see what we have resources for, what we can plan for. And even just getting those, even if it's something simple, like let's just even take the fires in terms of the evacuations, level 1, level 2, level 3. We know that at level 1, just have a bag ready. And the reason why you have that bag ready, because if you hit level 3 immediately, you don't have to think about that back.
Mhm.
Be ready. So if we can take away some of the stressors that we know we can deal with now, that'll be easier on us when these unexpected stressors happen, because they're going to.
Mhm.
They're absolutely going to.
Well, we're at 1 o'clock, and I just want to say thank you both so much. This has been incredibly helpful. I hope that the folks who are logged on have a couple tangible things that they can take away, and more so stuff that they can think about and how they can be, making sure that we're all addressing the mental health impacts that this year has had on all of us. I do want to let everybody know that we will have another Connected to Community webinar this Wednesday at noon. We're going to be talking about childcare and this fall, and how parents and employees can be supporting each other with their childcare needs. We'll talk about some resources that are out there for folks, some government programs that are out there for staff who maybe need help covering childcare costs if they didn't have with school in session before. So lots of good stuff to talk about then. Thank you both. I really, really appreciate you. I hope everybody has a wonderful week, and we'll see you all again.
Thank you.
Thank you. And Brittany, I'll just offer, feel free to share my email with attendees if there were some follow-up questions or something specific. I always feel that there's always a question out there that we just can't answer. And I'm again, allowing that to happen if there is something specific that I can be helpful with.
Thank you for that.
Yeah, I'm totally open to that as well.
That's wonderful. Thank you both. I appreciate that.
Yeah, thank you so much.
All right, everybody, have a good Monday.
Bye.